Thank you, Mark. When Ron's kids, my nieces and nephews, heard about this award, they thought I won it because I'm good at killing mosquitoes with my hands. I know that's not why you selected me, but I also know that I really don't deserve this award because all of the success was in place long before I was selected by the president, actually by Peter Orszag, to oversee this. It was put in place by Admiral Zimmer. It was put in place by Mark Dybel at PEPFAR, by people at USAID, and by many of the NGOs represented in this room who've really been working in this space a lot longer than I was. Last January, 2009, when we were reviewing the budgets, Peter leaned over to me and said, we just think through our global health strategy and make sure that we're really doing the right thing. And then I initiated a whole series of reviews of the program for my own education. Having worked in Africa, particularly in Mali and Malawi and Uganda, and working with Win Kalama in Tanzania, I knew that we were making a lot of success against malaria, but I also knew about the ravages of malaria, having visited many places and worked with many of the teams, mostly the research teams there. But when I reviewed and asked the Admiral to come in and present on PMI, I have to say, despite having worked for nearly a decade in this area, I was incredibly amazed. Mostly amazed because it seemed to me that PMI had to be the best kept secret in Washington. In a few short years, we had achieved so much, and yet here I was, someone who I thought knew something about malaria, had no idea how much success we were having, and I was sure that everyone else in Washington who didn't even know about global health had no idea the tremendous achievements we were getting. It seemed to me, more importantly, the more I heard and the more I looked at PMI, that it really was the model of what we needed to do in the President's Global Health Initiative. And I just want to go through the tremendous success PMI has had and how it's really informed what the President has laid out as his agenda. The first, as you've heard over and over again, it identified core strategies, core interventions, brought them together for synergies. The bed nets, the residual indoor spraying, the treatment, and the intermittent treatment for prevention of pregnant women. So you have things that work, you don't do them individually, you bring them together so you get the synergies of those effects. The focus on mother and children is clearly important. This is a disease that ravages pregnant women and children, and that has been a high priority for the President. The integration of the interventions with other programs, not having a standalone program, but trying to treat everyone when they come. Strengthening the health systems and working to train healthcare workers, working to ensure there are no stockouts, so we have all the drugs that we need and all the malaria nets that we need, where we need them, when the season erupts. About 2 years ago, I was in very rural Mali. It took us about 12 hours to drive to the site, and there we were on a day when they were distributing bed nets, condoms for HIV, family planning in one facility, and I had asked, and we went around to the huts to see, and there was a bed net in every single hut that we had gone to. Pretty amazing arrangement. Collaborating and coordinating with our other partners, many of the NGOs, but companies and many others. PMI has been a model in how to work with all those organizations that the Admiral mentioned. Country ownership, another very important principle that we want to include in the GHI and make sure that it's not just us imposing our vision on countries, but them adopting their own plans and are supporting them so that these things are sustainable over time and get woven into the fabric of the healthcare system. Again, PMI has been a model of that. And the last one, as the Admiral has mentioned, as you know, Emanuels are pretty impatient, and we don't like just good efforts. Touching people, passing out and counting the number of bed nets that we distribute, those are all good things, but they're not good enough in our opinion. What I especially liked about the PMI program was the fact that they could offer really hard outcomes, the precise outcomes that we care about. as you heard, the decline in malaria-positive blood smears, declines in under 5 mortality, declines in malaria prevalence and empty beds, which you can now begin to see, and declines in the severe anemia of children. These are the things that we really care about. We want to improve health. Death nets are fine. Number of people treated is fine, but actually making a difference so people are living longer, living healthier, that is really why we're in this game. When I reviewed the program, and I think I said this to the Admiral the first time, we have to get this out. We have to get the message that we have this incredibly successful program out. But it made it a lot easier for me, certainly on the inside, to champion the fact that we have a successful program and that we can do even more by funding it at a higher level. Let me say that there were 2 other factors that made it incredibly easy for me to champion this program and for the President to support it and to make sure that it got increased in funding. The first was that all these interventions, all the things that you people are doing in the room, on the ground, every day, have an unbelievable, terrific ROI. Nothing else we do has such tremendous returns. And let me just say, last week, Senator Kerry had a private breakfast in the Foreign Relations room at the Capitol for Bill Gates, and there was a discussion around the table, and someone in that room said that he was very happy about the Gates Foundation getting in because he thought that private industry and private philanthropy were really efficient, by implication slighting the U.S. government's role. And I piped up, given my situation, I said, there's almost nothing the U.S. government does, and I can't think of a single thing that has such a tremendous return on investment for every dollar spent that we have. We can save lives for hundreds of dollars, and almost nothing else can do that. And Bill Gates said, that's absolutely right. This is the best ROI he'd ever seen. That makes it incredibly easy to support this. In a time when, as you know, we have huge budget deficits, when there's real good justification for focusing on domestic programs, when every dollar spent in foreign aid has to be justified 1, 2, 3, 4 times, when we have a freeze on the discretionary programs, having that ROI really, really helps. Second, having a program run efficiently, having a very small staff that really does the job with no scandals and such tremendous success in a very short time, again, shows and it makes it easy to justify what we're doing here. When you have a program with this success, when you have it operating so efficiently, when you have such a high return on ROI, it sells itself, and it makes it easy to get the 36% increase in funding we got a couple of years ago, and the 13% increase in funding that we have put in the President's proposed budget. Why is that? These kinds of programs are not just good policy for us wonks, but they're good politics. They're good politics in foreign affairs, and they sell themselves, and all we have to do is sit there and be the cheerleader. I thank you for all your tremendous work in making these malaria programs successful and for keeping it up. And we do look forward, as the video says, to wiping this disease out and really making it a minor, bothersome issue and not a major health threat anymore. Thank you very much.